Hi, thanks so much for tuning back in. Today I'm going to be talking about Ehlers-Danlo syndrome, or EDS, and kind of going over what it is and what my experience with it has been. So yeah, thanks so much for coming along for this. So EDS is a genetic connective tissues disorder that affects things like your skin, your joints, your blood vessels. So it's impacting kind of the glue of your body, your connective tissues. There are tons of symptoms. I'll kind of go over those a little bit later. Not really many treatments, and a crap ton of comorbidities. So EDS is something that is super fun to have. Just kidding. It right now is classified as a rare disease, but a lot of specialists in that area don't believe it actually is rare. They believe it is just rarely diagnosed, which is quite sad because that means there are probably thousands of people out there living with this and not knowing about it and not getting some of the care that they could be getting for symptom and pain management. So I'm really hoping to spread awareness about EDS. I didn't know I had it until I was 25, and it would have explained so many things in my life. Like, not to get emotional, but thinking back on my childhood, there were so many times where I was called clumsy. I was always having random bruises pop up. I was always knocking something out of place or dislocating something. I was always in a cast or a brace because I was clumsy, and it was so refreshing at 25 to learn that I wasn't clumsy. I mean, maybe I was, but it wasn't my fault. It was the EDS. There was nothing I could have done about it. But kind of besides that, it would have been really great to know how to live my life a little bit differently. So when I was younger, I'm not very athletic, probably a lot due to the EDS. Not saying you can't be greatly athletic with EDS, but that was not the case for me. However, I was into competitive cheerleading and gymnastics, which was probably, looking back, the worst thing I could have ever done to my body. So it was very physical, very hard impact, it just terrible for my body. It's actually where I sustained at least 2 concussions. I pulled my AC joint in my shoulder out of place, and it's never gone back in right. That's where I got my first neck injury, and we're believing what kind of sent me down this path of neck, probably what ultimately led to the neck brace at 29 years old. So yeah, it would be really great to get awareness of EDS out there, so people could get diagnosed and could make different lifestyle choices or see different doctors. So May is EDS Awareness Month. So we've passed that for this year, but just really hoping to be able to spread the word about this a little bit. So as I mentioned, there are many different kinds of EDS. Right now it's divided into 13 subtypes. Now this did recently change. I am getting my information from the Ehlers-Danlo Society, so I'm hoping that that's accurate. Someone totally call me out if this is not accurate and has since been updated. But I'm going to go based off the 13 different subtypes of EDS. So I have the hypermobile EDS, and then I mean, I'm sure that's because of the community I'm surrounding myself with, but the majority of people I know with EDS also have the hypermobile kind. The hypermobile one's a little bit tricky because it is a clinical diagnosis, meaning there's no blood work they can do and be like, you have it or you don't. It is a clinical diagnosis. So I'll go a little bit into my diagnosis experience in a little bit. I do want to note, though, that I think for that reason it's really important that you are seeing a true EDS specialist. I know some specialists out there are trying to get the word out to like physical therapists, people who could help be diagnosing EDS a little bit more frequently. They've created something called the Beighton Score, and it's a pretty easy way to even like self-diagnose. I mean, I wouldn't suggest that, but like it's something that is a little bit more easily accessible than seeing one of the very few EDS specialists in the country. But because it is a clinical diagnosis, personally, I wanted to go to one of the experts. Okay, so one of the types of EDS is classical EDS. It kind of presents itself in very flexible skin, and scarring, and also hypermobility. There is also classical-like EDS, which presents with flexible and stretchy skin, but also velvety skin texture. There's also hypermobility with or without dislocations, easily bruised skin, and there are different diagnostic tests for both of those. There is Cardiac-valvular, I don't know how to say that one, which presents with cardiac problems like mitral valve, aortic valve. There is a skin component to that one as well, so like skin hyperextensibility, scarring, thick skin, easy bruising, and then joint hypermobility. So the hypermobility part we're kind of seeing is a thread through all of these different versions. There again is molecular testing that can be done for this version of EDS. There is vascular EDS, which is the second most common one I hear about. So I'm not saying it is the second most common one, but in the pool of EDS community that I'm in, that's kind of the second most commonly talked about one. This one has a family component, like documented causative variants in their gene that is responsible for this, which is COL3A1, and I believe that is kind of a newer finding, exactly what gene is responsible for some of these versions, which is great. There's kind of really scary arterial rupture at a young age, colon perforation, uterine rupture. So when I was talking earlier about, I would say there are varying levels of severity. To me, like, spontaneous organ rupture is so scary. So, I mean, I am daily living the pain of EDS. I am in a neck brace looking at brain and neck surgery because of EDS, so I am not at all putting hypermobility EDS down because it sucks. But yeah, vascular EDS is certainly one I would not want to have. Hypermobile EDS is the version that I have. There are no molecular or genetic causes of this identified yet, so I mean, funding and research on that topic would be so great. I'm going to go a little bit deeper into the diagnosis process for hypermobile EDS when I cover my diagnosis, so I'm going to kind of skip over that. There are other versions. I honestly don't even know how to say them, so I'm just going to drop the name down here. This one presents with bilateral hip dislocation at birth, which, side story, I was born with my hips dislocated, so we were a little bit worried that I could have that kind. It also has kind of that skin component with hyperextensibility, and then there is molecular testing for that one as well. This one, I also don't know how to say. I hope I'm pointing at the right side of the screen. I'm pretty new to this, so if it comes up over there, I'm really sorry. This one I'm not seeing on the EDS Society website exactly what the criteria are, but it is telling me that there are 9 major criteria and 11 minor criteria. So a very extensive diagnosis for this one. Confirmation is then done by molecular testing, and they do, like the other ones, know the gene that is responsible for this type of EDS. We also have this guy, which presents with a lot of joint dislocations and subluxations, specifically shoulders, hips, knees. There's congenital muscle hypotonia. There are different criteria that you have to meet, and then it is diagnosed again with molecular testing. It looks like there are a couple different genes, mutations that have been noted for this one, so that's pretty interesting. There is brittle cornea syndrome as another type of EDS. It presents with thin cornea with or without rupture, and then a couple other eye problems. So this one seems to be sitting mainly in the eyes. There is molecular testing for that one as well. This one, I also don't know how to say. It presents with short stature, muscle hypotonia, and the bowing of limbs, another type. This one comes with a specific type of craniofacial features which are evident from birth or very early infancy. It will also come with kind of those traditional EDS markers of skin, how stretchy your skin is, easy bruising, fragile skin. So that one also has genetic testing, molecular testing. We have myopathic EDS, which comes with some muscle atrophy, joint problems, hypermobility of the distal joints. We have periodontal EDS, which presents with severe periodontitis of early onset, so in the childhood or adolescent phase. There seems to be a lot of family history with this one, so a first-degree relative who meets those criteria. Yeah, so that is like the very, very most basic way to talk about the 13 types. I would totally recommend you check out the EDS Society's explanation. It will be far better than mine, and I will drop that link down in the text box. Okay, so to deep dive into hypermobility EDS, as I mentioned, no genetic markers for this one yet known. So it is a very complex set of criteria you have to meet to be diagnosed with this. You have to have joint hypermobility as one, and then you have to have 2 or more of the following features. So feature 1 would be just like systemic manifestations of a connective tissue disorder. Feature 2 would be positive family history, so 1 or more first-degree relatives meeting the diagnostic criteria. Feature 3 is musculoskeletal complications, and all of the next set that I'm about to say have to be met. So absence of skin fragility. We've already excluded other connective tissue disorders and rheumatological conditions. So we want to make sure that since this is a clinical diagnosis that we've outruled everything we can definitively test for first. And so something they use for documenting or diagnosing hypermobility EDS is called the Beighton Score. So this is a points system, and you can look it up and you can kind of test this yourself at home. So I had already known that I could do all of these things when I went into the doctor, but she obviously did them again. So there are some downfalls to this. Again, it's not definitive like blood work would be, and it's only assessing certain joints. So fingers, thumbs, elbows, knees, and spine. So you get a point each for both sides if your pinky can be lifted upwards at the knuckle beyond 90 degrees. So mine comes up like the whole way on both sides. They advise you do it on something flat. I'm not sure if I can get this oh, look at me being technologically savvy. So that would be 2 points because I did it on both fingers. My most flexible finger is actually this finger where I can like bend it back to touch the back of my palm. But that's not a test. Okay. Next is thumb flexibility. So you'll see if you can, I don't know the best way to shoot this. Get your thumb to touch forearm. So you'll get a point for both sides. I'm sorry, I don't really know how to film this. I'm new at all of this, guys. So those are the kind of things growing up that I didn't know everyone couldn't do. Would have been nice to know I had this a long time ago. So that was 2 more points for both sides. The next is looking at your elbow joints. So if this joint will hyperextend when you hold your arm up flat. I'm not sure if I can get it to be on camera, but if it goes like beyond flat, so you'll get points for both elbows that you can do that on. Next is the same thing with your knees, which I'm not going to do, but do your knees bend more than a certain amount forward, and then you can get 1 point for each knee. And then the next one is testing your spine. So it's you standing up straight and bending over and touching the ground with your hands flat on the ground without bending your knees. And that will be another point. I've actually seen some tests recently where it's not asking specifically if you can do that now. It'll be, can you do that now, or could you ever do that? So I found that kind of interesting. But all in all, you'll get a score of somewhere between 0 and 9, which will determine if you meet kind of that criteria for hypermobility EDS. I want to go a little bit into the symptoms of EDS. Each subtype of EDS will have its own symptoms. So I'm going to focus here on hypermobile EDS because that's the one I'm familiar with and I have symptoms of. So obviously joint hypermobility, very unstable joints that dislocate or sublocate easily, joint pain, clicking or crunching joints. It can cause fatigue, easily bruised skin. It can cause digestive and like GI problems. It can cause dysautonomia problems like POTS, which I have. It can cause problems with internal organs such as mitral valve prolapse, which I also have, and that was something I mentioned for one of the other types of EDS. It can cause bladder control problems, just a wide gambit of things that can come from EDS.
I'm consistently guilty of getting like 99.9% of the way done a video and then forgetting about it, so I forgot to ever end this video. So I wanted to go a little bit deeper into my EDS experience, like my symptoms, my diagnosis process, but this video is way too long, so check out part 2 of this video where I'll go a little bit deeper into my my story and my truth with EDS.